So good afternoon, everyone. Today's topic would be basic principles in anesthesiology, and I'm Dr. Shagun. And today's class will be on just the basic principles of anesthesiology. A lot of it was covered during the day case surgeries part, and I won't go into the details of the pharmacology of all the agents that are used, but I'll just brush upon them. Apart from that, the other things that are important for anesthesia perspective, I'll be talking about them. Yeah, so again, this just a small copyright or disclaimer about the ownership of these slides. They're completely mine, my hard work, and I would really appreciate if it is being used apart from this platform, my permission to be used beforehand. So yeah, about the objectives of the today's class would be to establish a strong foundation in anesthesiology principles, understand the anesthetic drugs and their mechanisms, learn the basics of pain physiology and management. You'll be able to master the fundamentals of airway and perioperative assessment. Yes, we'll be talking in detail about point number 4 because this is something that is usually skipped in other theory classes as well as the practical ones. So I'll be focusing mainly on the point number 4, and we'll also be able to appreciate certain safety principles and the legal aspects in the practice of anesthesia. At the end of this lecture, you should be able to describe the role of an anesthesiologist, especially in the modern patient care, explain the basic pharmacology of the anesthetic agents, apply principles of airway management and preoperative evaluation, and then recognize the safety, ethical, and legal issues in the anesthetic practice. And I hope all the anesthetists in the class today, they'll be able to apply the principles that they learned today in the class in their clinical practice.
Anesthesiology focuses on pain management and patient safety during surgery, using precise drug control and monitoring to ensure comfort, stability, and optimal surgical outcomes.
First, what is anesthesia? Anesthesia basically consists of 3 aspects. One is amnesia, that is loss of awareness. Patient doesn't have any memory of the entire episode in which they were given anesthesia. Analgesia, that is pain relief. Pain relief is, I would say, is more important, even more important than amnesia, because pain is something that patients remember throughout their life. So, and there has to be good analgesia throughout the procedure. Patient should not feel pain at all, otherwise it goes through their limbic system and then it just stays forever their life. And they, even if the surgical procedure everything goes really well, but if they feel pain at any point during their procedure, this is the only thing that they'll remember and they'll forget everything else. So yes, analgesia should be something that has to be taken care of, because otherwise there's no point. Then muscle relaxation, patient should have a complete body, all the skeletal muscle relaxed. Patients are not breathing at this point and have to be artificially ventilated. So yes, anesthesia consists of 3 things: amnesia, analgesia, and muscle relaxants. If you do not understand anything in today's class, if everything just bounces over the top of your head, even if that happens, I would still want you to at least remember this much. This is something that you must know. What is anesthesia?
Analgesia refers to the relief of pain without loss of consciousness, achieved through medications that block pain signals while maintaining awareness and body control.